Malaysian heart care takes center stage. My name is Zoe Teo for IJN Heart News, bringing you exclusive coverage of a historic collaboration between the Institut Jantung Negara and the American Association for Thoracic Surgery, a partnership setting a new benchmark for cardiothoracic excellence in ASEAN. For the first time, the AATS Cardiothoracic Surgery Workshop is being held in Malaysia, and IJN was handpicked as the host. Over 2 intensive days, top surgeons from Stanford, the US, and across the region came together to exchange techniques, explore real-world case applications, and perform live surgeries in an environment of mutual respect and skill sharing.
IJN is a very, very advanced center. When I first came here, probably almost 15 years ago, I remember seeing technology here that we did not even have in the United States. That's how advanced the system was that Azari Yaqub and Azani and Jess Dillon, close friends of mine, had built here at IJN. I was so impressed. I thought, wow, of all the places I've been throughout Asia, I don't think I've ever seen anything so advanced as IJN. And that always stuck in my mind, and I've been back to Malaysia a couple times. I've operated here, and this time I thought if we're going to go out somewhere in the world, especially if we're planning on going to Southeast Asia, I think we should go to IJN and start with the most advanced center and work with them and try to bring others from the ASEAN region to IJN to learn together. That's sort of the vision, and that's what we're going to do during the course of the day.
As part of Malaysia's flagship medical tourism hospital program, IJN has evolved into a center not just of treatment, but transformation. With new digital systems, patient-first designs, and international collaborations like this, IJN continues to strengthen its role as a regional leader in advanced heart care.
Okay, IJN has been pursuing this for a long time, and we are very proud to be one of the flagship hospitals. And I think today's event reflects our commitment towards achieving that, bringing international doctors, not just from the ASEAN region, but also from America, and sharing those experience. And with that, we'll be able to deliver better patient care to patients within the region. Right? Besides expanding the medical tourism market that is already out there, internally, we've also expanded a lot of things. We have, as you know, gone towards digitalization. Now, digitalization will help with patient care, patient experience, and outcomes. So we have already got that. We are fully electronic, right? And then for patient experience, our new kitchen, I'll start with kitchen first because, Asia Foods, new kitchen will be ready next month. So that will be able to cater for the various needs of the ASEAN population, right? And then we have another patient experience center which we've developed, recently opened, just I think last week, the new International Patient Center. This will be catering for the international patients. So those are some things that we have done.
In the OR, collaboration moves in real time. In a mitral valve repair led by Dr. Joseph Wu and supported by IJN's own surgical team, innovation met execution with patients at the center of every decision.
We had a complex mitral valve repair to do here. There was pathology on the posterior leaflet in P2, P3, also into the posterior medial commissure. So 3 different components, and we went ahead and started by exposing everything and then taking a very careful look at the mitral valve, and we found all of the pathology. So I think that this case was an excellent demonstration of what Dr. Moon talked about this morning, this bidirectional learning, and a perfect example of this multi-continental collaboration for the care of patients. I feel like if we can help one patient with one case, yet teach the surgeons something new, then they will help so many more Malaysians in the future.
Beyond the procedures, this workshop planted the seeds for future change. Senior consultants and young trainees alike witnessed how knowledge shared today shapes better outcomes tomorrow.
Today I was so lucky, so grateful that we are able to assist and observe a complex procedure performed by world-famous surgeon not only we learn about the latest technique, we also learn how to handle of managing patients with complicated heart condition. We are so grateful that IJN is given the opportunity to work together with the AATS. And we hope this event will continue in the future.
Institut Jantung Negara continues to push boundaries in cardiac care, proving that when knowledge is shared and excellence is pursued, lives are changed far beyond the operating table. This is IJN Heart News.